Hello, everybody. It's Captain Jonathan Klein, Commanding Officer of Naval Support Activity at Hampton Roads. I'm here with episode number 31 of Q&A with the Captain, our regular video series during the COVID pandemic to keep you updated on policies and procedures and answer your questions. This video is a follow-up to our video from a couple weeks ago where I was able to sit down with Dr. Julia Scheringall, one of the public health emergency officers at Portsmouth Hospital, and we talked about the vaccine and the development of it and some of the concerns that sailors had brought up about getting the vaccine. So as a result of that video, we got some follow-on questions, and I wanted to take some time to answer that for you. So the first question is, can I get COVID-19 from the vaccine? The answer to that is simply no. The vaccines currently in use don't use any part of the live virus, and therefore there's no way for you to develop COVID-19 based on getting the vaccine. So we'll just leave that one where it is. Question number 2, can a vaccinated person still transmit COVID-19? Well, here the data is not quite so certain. So the answer is maybe. Because of that, while studies are still going on, the scientific data is still being built. But because of that, even if you've been fully vaccinated, which we consider to be immunized, meaning you've had both shots, you're still going to be required to wear your mask, to do your physical distancing, and to follow all the protocols that we've been following for the last 11 months. As the data develops, we may be able to change that, but for right now, we don't know enough about it. So you have to presume that even if you've been immunized, you can be carrying and spread the virus. Question number 3, when can we eliminate some of the COVID restrictions? Once again, that's going to depend on the vaccine's effectiveness at preventing the spread of COVID, but it also depends on how many people get vaccinated. And so until we reach a point where, a majority of our force has been vaccinated, I anticipate we're still going to have some level of restriction on us, whether it's leave and liberty restrictions or the mask wearing and alternate work schedules and things like that, so that we can try to prevent the spread of COVID in the workplace. I'd say the most important thing here is we're never going to get to a point where we can relax those restrictions if we don't get enough people immunized. So if you're in a category right now that would permit you to get vaccinated, I encourage you, go ahead and sign up. And as soon as we get another turn to send people over to get vaccinated, we will. If you have concerns about getting vaccinated, please follow up with your doctor, follow up with a medical professional, ask your chain of command, ask me. I will get you the answers on any of your concerns about getting vaccinated. But until we get enough people vaccinated, I see those restrictions staying in place for quite some time, just until we get enough of the force to roll up their sleeve and get the jab. Question number 4, how long is the vaccine good for? It's a pretty common question, and I've actually had some people say, well, I don't know how long it's good for, so I'm not going to bother getting it until I know. I mean, that's a perspective you could take, but if it protects me for a week or a month or 6 months, I feel like that's better than being unprotected. And as Dr. Scheringall said a couple weeks ago, just because your likelihood of getting shot in Afghanistan is 1% doesn't mean you go out without body armor. This is your body armor. The studies are ongoing about how long the vaccine is good for. It might be that it ends up being an annual vaccination requirement, just like the flu. It might mean that you need to get a booster shot like measles or chickenpox or some of the other ones, yellow fever, that you have to get every couple of years. We just don't know yet. But that's no reason to not get it right now. The last question today is there herd immunity and when will we know? Well, once again, I'm not a doctor, but the data I've seen says 75 to 80% of the population perhaps needs to be immune before we reach herd immunity. Herd immunity is there's a part of the population that won't be able to get the vaccine for whatever reason. Right now, if you're under the age of 18 for one vaccine and 16 for the other, you can't get the vaccine. There will be other people who, based on medical conditions or whatever, aren't eligible to get the vaccine. So those of us who are eligible have to get the vaccine in order to protect those who aren't. That's what herd immunity is. And we have to have a sufficient number of the population that's immune to the disease in order to protect the rest of the herd. I don't know what that number is, but I do know that if it's 75 or 80%, something like 25 to 30% of our population is under the age of 18. So if the rest of us healthy adults don't roll up our sleeve and get the shot when it's our turn, we're going to have a really hard time getting to herd immunity. So I encourage you, if you've got further questions, please go ahead and ask them. Get them up to me. I'll go to the hospital, I'll go to the doctors, and I'll get the resources for you. And we can have a conversation about what your concerns are. So to close out today's video, we have, 50 or 60 folks in the command who have been immunized already. And so I've asked some of them to just offer a few words about why they got the vaccine and kind of what the experience was. And just so you can see that your shipmates are out there, your coworkers are out there, they're getting the shot. And I think it's important for everybody to consider why they do it and take the opportunity when it's presented. So that's all I've got for you. Till next week, wash your hands, wear your mask, stay safe. Captain out.
For me personally, I work in security over at Portsmouth Naval Hospital. So we're in the front lines of a lot of the COVID-19, not only the vaccine, but also the testing and a lot of patients that come through with the vaccine. So for me personally, it was a way to at least minimize the risk of contracting COVID-19 and then just subsequently protecting those not only around me at work, but also the ones that I come in contact with on a daily basis.
So I wanted to get the COVID vaccine to protect myself, but mainly to protect everyone else around me.
I decided to get the COVID vaccine when it became available to us for a couple of reasons. One, my mom has cancer and it's terminal, and the only way that I will get to spend time with her is if everybody gets through this together. And I wanted to be a good example to my son and my daughter so that when they get the chance, they do it too, and they don't think it's just a big joke.
Well, basically because of the job field that I am right now, we do work around with a lot of high-risk patients, and we do run out with the city, and we do, of course, here on base as well, and it's very important, in my opinion, to receive a vaccine. And as far as my family, I do have a couple of high-risk family members who are very susceptible of getting this disease.
I wanted to make sure that I wouldn't be able to contract the disease and bring it home and affect, my husband or affect any other friends or families that can easily contract it. And I just wanted to keep myself, everyone I work with, and everyone at home safe.
Well, I'd say if you are able to get the vaccine, I would recommend it. I would say the biggest issue that I've heard, or at least concern that people have, would maybe it hurting or side effects or not being proven. I can tell you from personal experience, I had no issues or no side effects that come with the virus, and I think, or with the vaccine. I think that the further that we get out in this pandemic, the quicker that we can flatten the curve, the better. And I think the first step is to obviously stay safe and to vaccinate.
So what I would recommend to those folks out there that are on the fence like I was, get vaccinated for the same reason I did. Protect other people. Protect yourself and protect other people.
So when it comes to all the people that are still on the fence, I think they're nervous about the side effects and such. This is the only vaccine I've ever not had side effects. So, I had a sore arm, but that was really it. I didn't have any fever, I didn't have any cold chills or anything. So, a sore arm for a couple days, and I'm healthier, and my family's healthier. So I think knowing that there's not going to be as much side effects probably kind of eases some minds. At least it did mine when I heard other people talking too.
Well, I would say it's entirely up to you, but in my opinion, I think it's something that is definitely worth looking into. And I would say, just go ahead, and it wouldn't hurt, especially you're thinking about you're protecting your fellow sailors or your family when you visit them, or they're visiting you, or any of the people that you haven't come in contact with. That's why I think it's very important to seriously consider getting this vaccine.
I would say do your research, ask people who have gotten both doses, about their signs and symptoms that they've had after it,